Hi everyone, my name is Caitlin Farrell and I'm a second year's Master of Athletic Training student here at Merrimack College, and my poster presentation is on the use of low-level laser therapy to treat musculoskeletal pain. So I broke this up into two different components. I have the research and my first-hand account of using this. So diving into the research, what is low-level laser therapy? It's light therapy that's classified as a Class 3 laser and is regulated by the FDA. It creates a photochemical effect, which is then going to trigger the biochemical changes within the cells, and then that's going to cause a reduction in edema, reduction in pain, and promote the healing process. Additionally, it's a non-thermal modality, which means it can be used in both the inflammatory response and the fibroblastic repair phases of healing. And lastly, it has a very high cost associated with it, so a 15-watt machine costs about $27,000. Now we're going to take a look at what actually is occurring at the cellular level and how low-level laser therapy actually works. So it's a single wavelength and it's non-thermal, as I just said, but it's also not going to emit any sound or vibration. It has the ability to penetrate through the skin, creating its photochemical effect and then ultimately causing those biochemical changes within the targeted tissues. But in order to have these desired effects, photons must be absorbed by the photon acceptor or the chromophore. Chromophore is the part of the cell that allows light to be absorbed. So once that chromophore is activated and can absorb the light produced by the laser wavelength, the effects can start taking place. Ultimately, this is going to cause the mitochondria of the cell to increase energy, nitric oxide, and reactive oxygen species. This is going to trigger the long-term effects of low-level laser therapy caused by the production of molecules from the stimulation of the mitochondria, leading to the activation of different transcription factors and causing an increase of growth factor. Now, when we're looking at treating pain specifically, low-level laser therapy is able to inhibit action potentials of the nerve, causing a slight neural blockade at approximately 10 to 15 minutes after the application, lasting up to 24 hours after the treatment. Additionally, this is just going to cause a cascading effect that suppresses the synaptic activity and does not allow for the pain matrix to be activated. Now, I know that was a lot, so the image on my poster here is just showing what I just explained, so how the wavelength of the laser comes in and triggers these changes in the cell, what the mitochondria is producing, and how that triggers the growth factor to actually make these changes. With that all being said, there's a wide variety of parameters that are going to affect our treatment. So our parameters are based on wavelength, power, power density, pulse, energy density, total energy, and time. So what this is going to look like for us is penetrating wavelength is approximately 760 to 850 nms. Light density is going to be 5 milliwatts per centimeter squared at 5 centimeters deep, and time is going to be approximately 10 to 15 minutes. Now, with that all being said, the World Association for Laser Therapy, also known as WALT, has their own dosage recommendations for different injuries. Now, there are some contraindications when using low-level laser therapy. First off, we don't want to use it over the eyes, and both the patient and the clinician should be wearing eye protection during treatment. We don't want to be using it over any cancerous sites, and it also shouldn't be used over a developing fetus in those who may be pregnant, and it should be used with caution in those who have epilepsy. Diving into the evidence, so for this, I looked at a few different meta-analyses that really looked at a wide variety of studies. And the majority of those studies determined that low-level laser therapy did have a positive effect on acute and chronic pain. One of the meta-analyses specifically had 18 studies that found that low-level laser therapy was the most effective when we are using those WALT recommendations. Now, there are some challenges to this research. First off, there's no long-term studies, so there hasn't been anything done that's been greater than 2 years. It's also very hard to compare low-level laser to other modalities because there's not that many light therapy modalities that are currently being used. And also, it's still seen as an experimental treatment by a lot of different insurance companies. Now, to conclude this research component, it has been found to be an effective treatment device to decrease musculoskeletal pain, but it's found to be the most effective when we are adhering to those WALT parameters. And lastly, it's not cost effective, so it's not going to be a realistic option for most settings. Now, jumping over to my first-hand account, the athlete that I was treating was a Division I baseball pitcher. He was a senior, and he just sustained a grade 1 wrist flexor strain of his right wrist. So for his injury presentation, His pain was caused by wrist flexion. He had decreased range of motion in his right wrist compared to his left or his bilateral side, and he had increased pain during the deceleration and follow-through phase of throwing. So I included a little image that shows the throwing phases here for everyone to see, and deceleration and follow-through is at the very end, and that's when we're going to start having our active forearm flexion and wrist flexion, and that's what was causing him the most pain. Going to our treatment plan, the plan was to use low-level laser therapy 3 times a week, following those Walt guidelines. And on the other days, he was going to be using thermotherapy in the form of heat pack, soft tissue manipulation, light stretching, and during all of this, he was following a throwing progression. So our main goal for the low-level laser therapy treatment was to decrease his pain, but we also was hoping it was going to promote the healing process here. Now, taking a little step back, I just wanted to highlight the laser I was actually using. So the laser I was using was the Light Force Therapy laser. And then on the right-hand side here, you can see the device. And it was very user-friendly. So I would just go in and choose the body part and the injury that I was treating, and then it would set up those Walt parameters for me, so I didn't have to go in and program it myself. Now, lastly, finishing with our outcomes. So the treatments and the outcomes were recording using patient-reported outcome measures. So we were always asking the athlete how he was feeling, how he thought the treatment was going. And this athlete really enjoyed laser. He thought it was very effective. He thought it was decreasing his pain. And that was a huge motivation factor for using it. It was a big driving force for why we were using it 3 times a week and why we used it as much as we did, because the athlete was actually feeling those results. Additionally, his progress and all the changes were being recorded in the university's electronic medical records. So all the progress he was making, any changes, the type of treatment, it was all getting recorded so we could look back on and see what our outcomes were, what was working, what wasn't working, and really progressing our treatment forward to make sure he was healing accordingly. So now, just to wrap this all up, low-level laser therapy was successful for this athlete, and it really was able to reduce his pain. Thank you to everyone who took the time to listen to my presentation today. I really appreciate it.